Stephen Intille, who is a professor in the College of Computer and Information Science, and he's working on making our lives even more carefully watched than they already are by studying what they can learn from the sensors embedded on our phones. And well, I think you already know enough about me, but it looks like you're going to show how the world is going to find out even more about me and everybody else. So take it away.
So I am in the College of Computer and Information Science and also in Health Sciences, and I'm going to talk to you about measuring behavior, and then at the very end tie that back into how we might look at emotions. And this, what I'm talking about today was really funded in part by the NIH Genes and Environment Initiative and inspired by that, and also the NHLBI at the NIH. So the takeaway message here is that big data at the individual scale is going to transform science and healthcare, and that mobile devices and sensing are going to play a key role. So what do I mean by that? Well, Rappaport has pointed out that even though we think a lot about genes and how understanding genes is going to make a big impact on health, really we know that behavior has a huge impact on that, probably much larger than the genetic information itself. So in one paper, familial and twin studies suggest that roughly 90% of cancer deaths and half of heart disease mortality cannot be explained by the genes and therefore point to environmental factors. So he goes on to define this thing he calls the exposome, which is what's going on inside your body, but then also what your body, what's interacting with your body, what it's exposed to. And you have things like environmental pollutants, things like radiation and air and water pollution, and things like infections. But then there's also diet, drugs, stress, and behavior and lifestyle. And I think if you drew these to scale, they might actually be much larger than some of these other things in terms of our overall long-term health. So what are some important behaviors and states? You have physical activity and sedentary behavior, diet, risky behavior, medication compliance, social context, socialization, subjective assessment of pain, stress and stressors, and then affective state. Lots of things there that we want to understand, and there's a big barrier here, which is that in a typical NIH grant review meeting where people are studying research, they're studying behavior, what's happening is that there's an elephant in the room that people are typically not talking about, which is that the underlying measures are often very poor or certainly suspect. In fact, I find it as a technology person who came into health often surprising how many PIs on studies have never actually even taken the own surveys that they're handing out and giving people to do in their studies. And when you do, it's almost shocking, at least for me it's shocking, because you have typical examples. This is one from sedentary behavior where you're asked a series of questions and you're supposed to estimate stuff that when you start to do it, it feels a little bit impossible. Here's a typical example from chronic stress. Somebody would say, I'll describe some situations that sometimes come up in people's lives. I'd like you to tell me if these things are not true, somewhat true, or very true for you at this time. So, maybe it doesn't sound so bad the first, I don't know, well, when you get to question 26, but then you find out that it's actually 51. Okay, and what do we get from this? We get a snapshot of behavior at one instance in time. So it's instructive to go and then to try to answer some of these types of questions that we ask about a variety of different types of behaviors. So I want to get you to think for a second, all right? Try to answer these questions in your head for yourself. So today, how many minutes have you spent sitting? Could you do it? How confident would you be? In the last week, how many sodas have you drank? Really easy if you don't drink soda. Not so easy if you do, right? In the last week, how many minutes have you been in the car? If you don't drive, it's easy, but otherwise it's pretty tricky, right? In the last year, on average, how many cups of tomato sauce have you eaten each week? Okay, you laugh, but our knowledge about diet and nutrition is based on questions like these, okay? In the last week, list all the events that cause you stress. So you're not even taking this seriously anymore. Okay, this is what our research is based on, right? Our scientific understanding and our health understanding is based on answering questions like these. In the last year, roughly how many stairs have you climbed per week? In the last month, how often were you caught in a traffic jam? In the last 10 years, how often have you won the lottery? Now that's easy, right? Because you'd remember it. But it's the mundane events that are most important to us, right? For health and understanding our reaction to situations. How many times were you awakened in sleep in the middle of the night each night in the last week? You can't even answer this question because we learn not to remember these events. Right? Approximately how many calories did you consume yesterday? On a scale from 1, very happy, to 7, very unhappy. How happy were you yesterday? That's a hard question to answer, right? On a scale from 1, very happy, to 7, very unhappy, how happy are you right now? Don't answer that one. Okay, so in the last 30 days, how many times have you taken a daily vitamin? Yesterday, how many minutes did you spend talking with family via email, messaging, phone, face-to-face? How many times did you sneeze in the last week? How many times did you sneeze in the last hour? Okay, our scientific understanding is based on these sorts of questions, and we need to do better, because when I don't feel good after I take these sorts of surveys, imagine sitting around for 2 hours answering these sorts of questions, and that's what our science is based on. And we forget about that sometimes when we get up to the level of charts and tables and ultimate results, but we want better quality of answers to this. So for me, the bottom line is our tools are providing really crude snapshots of behavior and dynamics and all the interesting relationships between behaviors that they're unable to even be explored. And we need new approaches. So a big opportunity, I think, in terms of research is today we have these surveys with these behavioral snapshots, limited information about the context, limited information about the dynamics, costly recruiting to get people to do all this stuff, and limited information about why they're making the decisions they're making. So imagine soon you might have open source phone apps with optional add-on sensors, months of continuous dynamic data, where citizen scientists, maybe thousands of them, donate information for the sake of science. You get contextual and purposeful information about why they're doing what they're doing. And we might supplement what we have today, which is a lot of hypothesis-driven investigations to understand correlations, with also having data-driven incremental and interactive discovery that can support not only new science, but also new design. So I mentioned design because it's really important, because it's one thing to understand a health outcome, which is something causes something, but I want to fix the problem, and I want to use technology to help do it. And the problem then is you have to think like a designer. What does a designer want to know? They actually want to know even more than the scientists want to know. So let's say I want to build a technology to help this guy walk more, right? So I want to know, does this person normally walk in this situation? And I wanted to deliver him a message right now, right? So why is this person walking now? What are the characteristics of his environment? Who's this other person? It matters. What's the relationship and conversation between these two? What is the person most likely to do next? What will this other person likely do next? And what immediate opportunities does the environment create? What happened last week and what happened last year? So if I want to design a really good tailored intervention, this is the stuff that I want to know. But now we have all these great new technologies, and we might be designing these new interventions. That's the really exciting thing, that I might want to deliver an intervention via a phone, right? But I could also measure via the phone. But I also have other opportunities. I have the friend's phone, if I know enough about what's going on, right? I have displays in the environment, computers at home, computers in the car, computers at work, messages from social networks, nearby stranger's phone. Now that sounds strange, right? But I can think of ways I could use a nearby stranger's phone to potentially influence behavior. And then we have things coming out now like Pebble smartwatches, and then also we're starting to play around with head-mounted displays that might have even augmented reality opportunities for displaying information and getting information back. So I'll just give you one example of the type of thing that my group works on, which is heading towards population scale, long-term measurement and sensing. And we've done most of our work in physical activity sensing, but it relates ultimately to understanding behavior more generally. So the vision here is a population scale measurement where there's you with your mobile phone. It's got sensors already in it. There's a researcher who wants to do a study. They upload their study to an app store. You download it as a citizen scientist and run it on your phone. Now your phone has sensors in it, and it starts doing activity recognition and gathering information. You report a little bit back. It's got location information. And then the researcher can change that study on the fly over a long period of time, changing the surveys that get asked, changing the tools that are used, and then the data could flow back to the researcher essentially continuously for continuous analysis of some sort of study. And the researcher may then eventually say, I want more information. So the researcher will send a few little cheap sensors to the person can wear them however they want, a little flexibly underneath their clothing. And then ultimately the phone knows what's happening in real time and can provide feedback, which is why these people might want to wear this in the first place, because it might actually do something ultimately useful for them. The question is, can we get people to do this for years? Because if we do, we get a new type of data that might really change science. And you have people wearing lots of monitors today, and then groups like mine that sometimes, for better or for worse, we have to create our own because the ones in the market don't do what we need. And so we've created our own. We call them Wockets from Dr. Seuss. There's a Wocket in your pocket. You wear two, you charge two, and they're real time. They send data to the phone in real time, and the phone can process it in real time. They're designed to be really thin relative to other monitors, so you can wear them under your clothing. And a day in a life of a participant in this case would be that you get up in the morning, you swap the sensors, you wear two, one on your upper body, one on your lower body, you go about your day, use your phone normally. Your phone every minute essentially knows a little bit about your physical activity, tries to infer that, and then at night you place your phone by your bed, it transmits the data to the researchers, and then the phone is also used for self-report, which I'll come back to in a second. So we're working towards 24/7 knowledge of activity type, duration, intensity, and your location, but also adding other information like your communication or social interaction or use of technology and combining that with self-reported state. So at a meeting, this is data from when I was at a meeting like this one at one point, and this is just the data from my mobile phone, and I got up early in the morning and walked to the meeting, and then I was in the meeting doing nothing, so my mobile phone was not really moving, and then I took a break, so my mobile phone moved with me, and then I was in the meeting, and then I was doing stuff for lunch, and then I was sitting, right? So this type of meeting is not good for your health in terms of your sedentary behavior, but you can then add additional sensors, so wrist sensor data on top of that, and then ankle sensor data on top of that, and other data. So this is the tool that as researchers we see when the data comes back to us, and we can start thinking about how do we use this to understand a person's behavior in a particular research study. So where we start is with lab data. We put as many sensors as we can on people and have them walk around campus and other places, and then we annotate what they do with students who follow around with tablets and label what they're up to, and then say, can we get the computer to detect what we're interested in? And then all the numbers here aren't really important, but generally, if we have lots of physical activities, depending on what we do, we can either half the time generally know what they're up to, or more of the time if we get more sort of person-specific data. But if we're really less picky about what we want to know postures and ambulation with not necessarily are you walking moderate or just a little bit faster, but a little less categories of information, we can still do pretty well. So the way this data looks, this is data for me in my kind of boring, repetitive life, where this is data from my wrist and data from my ankle. The two scales are a little bit different, but you can see whenever I do something major, I have these big transitions that jump right out in terms of the motion of my wrist and my ankle, and you see differences between different things when they happen. And we're also doing stuff where we use the same sensors to understand what you're doing during sleep. And there's a lot of detail here if you actually know what's going on. So this is my arm every 15 minutes hitting snooze. All right. So, and what you see over multiple days is I start doing it over and over again. So you would never be able to know that from one little bit of data here. But imagine that you have data over time, and at one point, sometime, I labeled what this was. Because we then start propagating that information forward, because you tend to see people doing the same stuff over and over again. Right? And so the question is, can we gather data differently than we do now by looking at the larger data set, but then ultimately get a lot of detail? Here's me lecturing where I'm walking around. Here's me in a meeting where I'm not so much, right? So the sensors can see a difference, and that means that it's likely we can get computers to detect all these differences. These here, we can do some things with the motion automatically. Some of these things, like eating, require self-report. But imagine that you had this type of information plus social interaction, plus location, and more for long time periods. That really might change our research methods and our research questions and allow new innovations. So we get down into the details trying to figure out how do we make these fitness monitors where there's a lot of hype really work. So we've done some work recently, again, all the numbers aren't important, but looking at a wrist and an ankle mounted sensor and saying, for specific categories of activities, how well really can you detect them? And we can do pretty well on 4 categories on the wrist, which is a deceptively hard problem because I'm up here gesturing and doing things, and so the wrist-mounted motion sensor is going to register all that, and yet I'm not actually ambulating, right? And so what we've been doing then is taking that type of lab data and then saying, if we want to do something in real time, can we? So here's a quick little example video, if I can find my actual. Well, you can kind of hear it from there. I lost track of where my audio plug is. There we go. All right, so this is, whoa. Okay, so this is a person wearing one of our sensors, and the phone is just there, and this is just clips of when the person was doing various things. So we have an ankle and a wrist-mounted sensor. They're both operating independently. If we use two, we can do really good recognition, but this is one at a time. And each sensor is essentially trying to say, what location am I at, and what am I actually doing? And so, and then the phone periodically is getting the data in real time, and in real time trying to figure out what is this person actually up to. And so some of these aren't that hard if don't seem that hard if you're in engineering anyway. But then you get complicated cases like biking, and it's not so straightforward to know from the wrist that this person is actually biking versus doing other activities, right? So we're trying to get down and say and then you can see. So in this case, it gets cycling from these two. Okay, so we're trying to figure out how do we make these things really work. And ultimately, we want to reinvent self-report. So the passive sensing is excellent when it works, but I think we have to be realistic to say it won't always work, right? And there are other things that we can't sense and we have to ask. And so what do we do there? So we use a lot of experience sampling, also called ecological momentary assessment, and Lisa was a pioneer of the use of this sort of technique in psychology, where your phone beeps and it asks you the type of questions that we talked about at the beginning here, right? But where I think the exciting part is in the context-sensitive EMA, or context-sensitive experience sampling, where we've done things where we prompt a question when a kid uses a Bluetooth-enabled inhaler 5 minutes after the inhaler event, so we can understand that exposome, right? Where were they? What was happening? All the important stuff that led up to that. And then similarly here, we prompt questions in this study based on whether or not the phone itself has experienced 60 minutes of motion or no motion, which probably corresponds to whether or not you may have experienced motion or not motion in some cases. And so going back to our interface, then the data comes back, and not only do we see kind of summaries of the motion data, but we also see these are places where people answered self-report, and these are triggered based on particular things that happened in the data that's getting collected and analyzed passively. And then we're also bringing people in, and this is another study where high school students are using their normal mobile phone in a normal way, and when the phone data gets chunked up over time, and then at the end of the day, they essentially play a little, it's not much of a game, but they go through this exercise where it chunks up things and it figures out the times, the start times and the end times based on when their phone moved. And then they label what they're doing throughout that entire 24-hour period. So they're basically filling in the gaps where all they have to do is run a little app on their phone, and the phone's motion is monitored, and that's time chunking their day up for them in a nice, natural way. So it's a sort of assisted self-report type of strategy. So finally, I'm going to end here. So what does all this have to do with effective science, right? I think to understand an emotional reaction, you're going to have to understand the context that people are in. And I think it's a bit of something that initially might not seem so obvious, but a lot of researchers in health, they just study in their narrow domain. The nutrition people study nutrition. The physical activity people study physical activity. The stress people study stress. And I think for us to get a holistic, comprehensive view and really advance science and health, what we actually want is a holistic view of an individual at an incredible level of detail. And we're just at the point where we can start to create those tools. And to push back on the hypothesis, before he starts asking questions, does everybody need this, and do we want us all to be monitored? No, okay? But let's think of this from the point of view of a research tool and say, would 1,000 people in the country or 10,000 people in the country donate this sort of data if they felt like it was adequately protected? And what could we do in terms of understanding science and health if we did that? And so that's the thought I'd like to leave you with. So for more information, you can send me email or my group's website, or I'll second Matthew promoting our interdisciplinary PhD program in personal health informatics at Northeastern, if you're interested in this type of stuff.